First Lady of Bungoma County, my elder sister, Caroline Wangamati. I think she's very happy today. For the first time, I've just accepted. Because apparently someone has my ID and her ID and yeah. Your Excellency, First Ladies from other counties, representatives of the county government of Bungoma, representatives of national government, partners, wananchi watukufu wa Bungoma, inanipa furaha kuu kuwa katika hii county siku ya leo. I think one lady alisalimiana na Kiluya alisema mrembe handi. Whatever it means, I think it's good, so I have to say it. Mrembe handi. And then I also had mrembe te. And then there's a statement yenye narudi yangu inasemanga tawa. So I'm really happy and honored to be here. Allow me to read a short speech before I say much. It gives me great honor and joy to be in Bungoma County today for the launch of the Empower Cancer Clinic, the third in the country after Meru, Kisumu, thanks to the efforts of the County First Ladies Association and other notable partners. The County First Ladies Association is a forum of female spouses of sitting elected governors from the county governments of Kenya. The association was formed out of desire by the County First Ladies to contribute to the social economic development of their counties through advocacy. At the heart of CFLA is a desire to ensure massive and radical development in the health sector that directly affects all other aspects of socio-economic growth in the community. To this end, CFLA engages in advocacy and mobilization of resources to complement the county government of the day for greater impact. Ladies and gentlemen, research today reveals that cancer is the third highest cause of morbidity in Kenya. Even more grave is the fact that women continue to bear the brunt, with breast cancer taking the lead, followed closely by cervical cancer and then prostate cancer. Further research reveals that 70% of all cancer cases are diagnosed late due to lack of awareness, lack of treatment facilities, and high cost of treatment. Because of these grim facts, ladies and gentlemen, women continue to bear the burden of health management, with them being not only victims, but also primary caregivers and drivers of the economy in the counties. It is for this reason that Empower was birthed. The enabling and motivating partnership owned by women to engage and reclaim their lives, Empower project seeks to contribute to the prevention of early diagnosis and treatment with a standard care and education of women in the community on breast and cervical cancer. The Empower project, which is in partnership with County First Ladies Association, Roche Kenya, Women for Cancer, and Africa Cancer Foundation, will contribute to the prevention, detection, and prevention of cervical cancer and breast cancer through awareness creation, advocacy on strengthening the Kenyan healthcare system in dealing with non-communicable diseases, and championing universal health coverage across Kenya to ease the cost of treatment for patients living with cancer. The project also intends to create Empower clinics in phases. Presently, 8 counties have been identified for the pilot project through their level 5 hospitals that will drive the facilities awareness, that will drive and facilitate awareness creation through mass education, early detection through regular screening, treatment with the best standards of care, and creation of decentralized referral pathway for treatment across the country. The 8 counties are Kisumu, Kakamega, Bungoma, Nakuru, Taita Taveta, Laikipia, Meru, and Makueni. In the second phase of the project, which will be implemented in 2021, the Empower Cancer Clinic will be launched in Nandi, Nyandarua, Narok, Kwale, Isiolo, and my very own county, Marsabit. Ladies and gentlemen, my speech cannot be complete without mentioning the great role of Her Excellency Caroline Wangamati has played and continues to play, both in our team and this country, in championing for better health care for all. Her passion and networking skills are what we all need if an overhaul is to be achieved in how we perceive and handle the health care as a country. It is my hope and belief that the county government of Bungoma, through the healthcare department, will offer this clinic all the support it will need for it to offer the reprieve and service it plans. And now, on behalf of the county First Ladies, I take this opportunity to thank the Empower partners and congratulate Bungoma County on the launch of the Empower Cancer Program today. Asanteni sana. I'm also proud of her. Being a bigger sister, one that holds somebody's hands, one that takes you through the system, one who never tires, one who always is there to support, one who doesn't take care of herself and puts everyone else's first, one whose pressure normally is not her own family, but the family of Bungoma County. I will always salute her. Thank you, Caroline Wangamati. This issue of cancer has been of great concern in this country. Cancer has taken many lives, but cervical and breast cancer are cancers that can be cured if intervention is made at early stages. Unlike the other cancers that are diagnosed when they are at a later stage, once screening is done, one who is at the first stage of breast cancer and cervical cancer can be healed. And that is why today as women, we stood up and we are standing with our sister so that we can advocate, we can reach out to everyone out there. Let us go for screening so that, just like, they used to say in HIV campaign in the 90s, let us know our status. Let us go out and get screened and know what is it that is ailing us, and in case this thing is found, it is treated early. The other issue I would like to talk about is about hospitals. A hospital is a healthcare center. A hospital is not only to be visited when somebody is sick. A hospital you should visit for routine checkups so that you are able to know your health status before it deteriorates or something comes up. It is okay to go through all the checks and get an excellent result. You go home and sleep well. So let's take hospitals as healthcare centers, but not just for when somebody is sick. And with a lot of improvements that's happening in the county government of Bungoma, then we will have a lot and services that are being offered, then people can go out there and talk about. The other thing I would want to talk about is about teenagers and teenage pregnancy. Teenage pregnancy has been very high, and Bungoma recording high number of teen pregnancies among the counties in Kenya. Teen pregnancies happen, just as my sister Shayla said, because we do not want to give time to our children, that we do not want to calm down and talk. I think times have changed. Times have gone. That, those days when my dad used to enter the house and we all shut up and go under our beds and nobody speaks, because the boss has entered. Kids nowadays require love. They require to be nurtured. They require to be cultured. They require to be guided so that they can be able to bring these issues to you. With COVID, we've had our children with us for the last 7 months. It's been a challenge, I'm sure each parent can talk about. But teen pregnancy, if a child goes through school, for example, if a child finishes from 4 at class 8, it's a way of making it longer so that the first birth is taken a bit far. Because if a child gets pregnant at the age of 15, there are so many other complications that come with this, including fistula. The fistula comes that Her Excellency Wangamati has been doing around here. Many young people having issues. So let's talk to our girls, let's guide our girls and talk about it. In the county I come from, there's a lot of FGM. 98% of people in Marsabit practice female genital mutilation. I hear in your county it is not that rampant, but an area called Mount Elgon practices this. It is backward, it is evil, it is against humanity, and it should not be practiced in modern society. I would want to condemn it in the strongest term possible. The president has given directive that FGM must end from Kenya in 2022, and we must work towards that. Excellency Wangamati, I know your hands are full, but on this one, you must take lead role, because the consequences of FGM are very bad. And there is now cross-border issue. And the whole thing about Caroline Wangamati again. Sometimes when she stands up and speaks, with all due respect to His Excellency Governor Wangamati, si munaonanga tu anakaa governor? Si ni ukweli? Si ako poa? That's why Waswahili husema ukiona vyaelea jua vimeundwa. Governor Wangamati cannot shine if he has no Caroline in his house. That's why they used to say, behind every successful man, there is a woman. Currently, the new saying is, beside every successful man, there is a woman. And beside Governor Wangamati's excellent performance in education, in health, in road. Thank you, Driver Ramadan. We came in last night and he was a very good tour guide, because once we entered town, we were taken round. Your Excellency Caroline, we were taken round, we were shown the roads, we were shown the building, and today we've seen the hospital. He is shining. And whatever he's doing it out of his heart. He is willing to serve the people of Bungoma, and passionately. And my Caroline never just took a title of a First Lady and dressed like a flower girl to join Governor Wangamati only on public events. She has chosen to walk the path with Mr. Wangamati, and sometimes walking ahead of him, as we have had in ICU, where she was able to bring partners to bring ICU to Bungoma County. So let's support them. We know what they want, but that's not, we don't want to give them the second term just because it's what they want. When the scorecard comes and you feel like Governor Wangamati deserves it, and you feel like what they have done for the people of Bungoma is good enough, there are things that need to be finished, please support them, because even God above will be watching you. In terms of other programs that we do, County First Ladies, each County First Lady is passionate about different things. Her Excellency Edna Lenku talked about the environment. She runs a program called Takataka ni Mali with our First Lady of Taita Taveta, where there is recycling of dirt and garbage, and they're able to create youth empowerment. There are other excellencies like Her Excellency Nyandarua is, she talked about potatoes, so Kikuyu na viazi. So she's passionate about potatoes, and I think they're adding value to the potatoes so that they don't get rotten in the market. And many of us are running, all of us, mentorship programs. So, in echoing what the MCA said, that our office does not have funds, that our office is not even respected within the county governments, in recognition that some of county staff look down upon us as like people who just want to go out there be seen. Our good work has been seen in Bungoma County, and the Assembly has spoken about it. Before we appeal to the national government, they have powers within themselves to be able to do something within the office of the governor, to be able to allow Mrs. Wangamati to move around and even distribute her mama kits. As I'm here, there are two people who have not been introduced. The first one is our CEO of the County First Ladies Association, Janet Sayo. Madam Janet Sayo is behind everything we have been doing as County First Ladies Association. She's a lone ranger who coordinates the whole secretariat. She puts everything together and works with partners. And today's Empower, as we give it access to the county government of Bungoma First Ladies Office staff, we would like to recognize the good work done by Janet Sayo. Maybe Janet Sayo will stand up and wave to the crowd. Thank you, Janet. From Marsabit also, I was able to come along with my able program administrator, Abiba. Wherever you are, you could wave. And as I finish, I would like to thank Bungoma County, the beautiful people,
the people of, they look similar to us here hivi. I don't know if you know where Marsabit is. Marsabit iko huko juu north. Inachukua masaa 12 kutoka Nairobi. And this lady made me travel from Marsabit 12 hours and then come this way. It is the love I have for her, and by extension, the love I have for the people of Bungoma, that makes me be here at this time, having traveled from Marsabit. Yesterday landed, hatuna ndege, nimesahau. Tulikuja kwa gari alafu tukapanda ndege tukafika Kisumu. So mtuombe ndio sisi pia tuwe kama Kenya. So sasa shukran kwa kila mtu ambaye amefanya hii program iwe successful. Kwa wingi naona wamama, hata administration wote ni wengi ni wamama, CCs wenye wamekuja wengi ni wamama, MCS wenye wamekuja wengi wamama. We cannot work alone, and if men do not support us, we cannot be able to make it. Just as we support you in your program, please men, please our brothers and our fathers, support us in everything that we do, and this country of ours is going to go ahead. Many greetings from the Governor of Marsabit County, His Excellency Mohamud Muhammad Ali. Thank you very much.